Hello. Have you ever wondered what different mental health professionals do? What is their main occupation? Sometimes people wonder what's the difference between psychiatry, psychology, and counseling. There are other areas, of course, of mental health provision, but these are the main three. So I just thought I'll do a very quick video to explain it all. Psychiatry really deals with mental illness. So a psychiatrist would usually train as a doctor and then specialize in psychiatry, and they are also qualified to prescribe medication. And part of the treatment would be talking therapies, but also medication. And they would deal with a lot of more serious, shall we say, mental health issues like schizophrenia or paranoia, that sort of stuff. Psychology is slightly different. A psychologist is really interested in the relationship between mind and behavior. So a psychologist is usually a PhD or a PsyD, a doctor of psychology, and they would really kind of look into the how our behavior operates, why we behave the way we do, and they'll possibly do some research on it as well. And they don't have the power to prescribe medication. And they will be most of the methods they will use will be things like cognitive behavior therapy, and there will be an element of psychodynamic, which essentially is going back to Freud and to his idea of the conscious and subconscious. But a lot of the stuff will be really about how we behave and why do we behave the way we do. So that's what psychology do. And the counseling is really concerned with more day-to-day, if you like, mental health provision. A counselor will advise, will listen, will provide a very warm and safe environment for you to work through some issues that you may have. And if you like, simply put, they'll be more interested in the kind of emotion of it all. If you like, psychiatry is really all about the illness. Psychology is really all about the behavior, whereas a counselor will really look about how does it feel for you? What's your lived experience like? How does this particular issue influence your day-to-day? And they will deal with, counselors will deal with things in a certain way, but one of the most important ways will be what we call a person-centric technique, which essentially is putting the client first and making sure that their experience of therapy is as genuine and as valuable as possible. So if you do think that you might require some mental health support, it's important to understand the differences between these three categories and these three disciplines, if you like, and these three approaches, and maybe choose the person that you think is best for you. See you next time.